Okay, we are going to go ahead and kick things off. I know a few people are still joining us, but we want to be mindful of everyone's time. So thank you for being here today. Welcome to Bearcats Health. This is our back to school COVID-19 tips. We'll start here in just a few minutes. We'll have our UC and UC Health expert panel of physicians who are going to share COVID-19 precautions and tips for school and college-age children as they're returning to the classroom. This obviously is very timely, and we know you have lots of questions, so we're excited to get some answers to them today. I'm Cynthia Miller, Senior Director of Alumni and Donor Experience, Constituent Engagement for the UC Alumni Association. It's always such a long title, but I want to thank you for joining us today. A few quick housekeeping items before we begin. Please know that this program is being recorded, and we will email the link to all attendees and share this on our social media channels as well. Please note, as an attendee, you are muted and your video has also been disabled for this call. It might look to you like you're the only attendee, but that's not the case. We have over 100 attendees registered and lots of people joining us today. After introductions, we're going to jump right into the Q&A portion of the program. So please submit your questions for the panelists by using the Q&A option at the bottom right of your WebEx window. We'll do our best to answer as many questions as possible, but if for some reason we're not able to get to a few, we will include responses to those in the post-event email that will be sent out later this week. If you need any tech assistance during the program, please reach out to Lori McDermott. She is our IT expert on the call today. Her contact information can be found in the confirmation email you received this morning. We'll now begin the program with a brief video message from the Executive Director of the UC Alumni Association, Jen Heisey.
Welcome to today's program, one of many offered by your UC Alumni Association. Before we begin, it's important for me to say thank you for joining us. By actively participating in our offerings and experiences, you are harnessing the power of your alumni network. There are Bearcats all over the world, more than 315,000 alumni in 127 countries, which makes virtual programs like this so rewarding. These challenging times do come with a silver lining. We are more connected than ever before, creating boundless opportunities. The University of Cincinnati and each of you is stronger and better positioned because of our lifelong connections through our alma mater. We love providing opportunities like this one, where alumni can learn, network, and give back. So settle in and enjoy today's program. And if you like what you hear today, please share it on social media using the hashtag #ThyLoyalChildren. Thanks again for joining us. Go Bearcats.
Great. I'm now pleased to introduce our moderator for this evening, Lauren Moore, Director of Marketing and Communications for UC Health.
Good afternoon, everyone, and thank you for joining us today. I'm Lauren Moore, and I am pleased to be your event moderator today. The purpose of today's session is to provide all of you with an opportunity to submit questions in the Q&A box pertaining to COVID-19 as it relates to students of all ages going back to school. We will now jump right in and begin today's session with an introduction to our three physician panelists, all of whom are UC Health alumni and parents with children from school age to college age. These clinical experts will answer many of the questions that you share with us today. Dr. Chris Lewis is Vice Provost for Academic Programs at UC, Professor of Family and Community Medicine at the UC College of Medicine, and Primary Care Family Medicine Physician at UC Health. Dr. Jen Forster is an Associate Professor of Medicine at the UC College of Medicine and at UC Health. She is an Associate Chief Medical Officer, an Infectious Disease Specialist, and COVID-19 core team member. Dr. Michael Holliday is an Associate Professor of Family Medicine at the UC College of Medicine, Medical Director at UC's University Health Services, and Primary Care Family Medicine Physician. Welcome. We're going to dig right in. Drs. Lewis, Dr. Forster, Dr. Holliday. The first question that we've received today is, last year was challenging for kids and teens and college students. what are ways that we can best support our children's emotional, physical, and learning development?
That's a great question. I'll jump in. My role at the University of Cincinnati is kind of broad. I do a lot of things here in the provost office and also for UC Health. But one of the things that I'm doing at UC is I'm on the COVID response team. And a lot of what we talk about in terms of our 47,000 UC students, college age students and other non-traditional students, is how we strike a balance between health and safety and also protecting the mental health and well-being of our students. And really it centers around acknowledging that these are not normal times, and the strangeness of the times that we're in have the potential to impact younger people even more than they impact us grown folks with no hair. So, that recognition and the recognition that we all need to be a little bit more understanding and more supportive, I think is important. I think making sure that we take advantage of opportunities to have some sense of normalcy with our school-age children and college-age children. One of the things that we're doing at UC is prioritizing how we get students engaged in activities and clubs and that sort of thing, whether in person in a safe manner, outdoors or with masks indoors or virtually, and making sure that we, do all that we can to enrich their academic experiences with social experiences. And I think that while that's my role at UC, for the college, for the university, I think that same advice is applicable, from kindergarten all the way up, making sure that we understand that these times can be even more trying for young people in certain scenarios, and just being patient and understanding of what those kids are going through and trying to give them as much normal activity and fun activity as you can.
I echo that, Dr. Lewis. I think acknowledging that this isn't normal. This isn't what, it was supposed to be like think about it. One of my favorite times of life was being a freshman in college, right? And that they didn't really get that experience, or being a senior in high school, all those kind of things. Like, that's not the way it's supposed to be. But I'll add to that by, this also gives us an opportunity to, ask at least younger kids, maybe this isn't necessarily the case for kind of the older kids, but what is upsetting you, and what's on your mind? Maybe not even what's upsetting. Maybe they just kind of want to know what's going on, and answering their questions. Like, my kids have been really interested in what I've been doing and why I'm doing it and why I say something. Sometimes they question me, just like everybody, they do for every other thing, right? They're totally, just interested in knowing why I say one thing or something. So, I think it's kind of fun, and it's fun to have to explain that to an 8-year-old and then maybe a 16-year-old, but it gives us an opportunity to try to, just hear what's on their mind, and it might be different than what we expected.
Dr. Forster, I agree. Just the importance of reaching out and asking, what is their experience? I've seen some really good materials from the AAP and also the CDC, and they outline the reality that there's been a lot of disruption, and you can put those into different categories. One is routine. Routines have changed. Another one is disruptions in healthcare, continuity of education, and for some kids, unfortunately, security when it comes to food and housing, and then just loss of major events. And so I think being mindful that those categories are the big hot button ones that our kids might be struggling with, and just imagine, oh yeah, that's right, we didn't go to grandparents' house this past time. How are you doing with that? And the ways that we can approach those different categories obviously differ. So the healthcare needs of an infant are going to be different than the healthcare needs of a college student. But there's some catch up to do with healthcare for these different age groups. And there's maybe opportunities to try to get some creative ways to get some of those missing life events back, but hopefully safely. And I think that's what we're trying to do at UC as well, trying to get back to normalcy as much as we can, realizing the costs of eliminating in-person education, but also trying to do it in a safe way.
I agree with my physician colleagues. Excellent comments. And I would also add one final remark. One of the silver linings of this pandemic, in my mind, is that it creates a supreme opportunity for parents to talk to their kids about being decent citizens and caring about people around them. You know, whether it's my 5-year-old asking me, Daddy, you're vaccinated, why are you wearing a mask? And me explaining to her that, you know, I feel like it's my duty not just to protect myself, but to protect my family and those around me. I think that's one of the things that has gotten my family through these challenging times.
That's excellent advice and input from all three of you. Thank you for that. Another question has just come through. Will the 12 and older age group, including teachers, have to be vaccinated in order to be exempt from having to wear a mask at school or other locations in the future?
I'll take that.
Oh, go ahead.
Oh,
Go ahead.
I mean, I think we have a lot to learn. So one of the things that and I don't know that we know the answer to that yet. So I have always started, those of us in medicine know that nothing is black or white, and I think that it's easier when things are a yes or no, or high or low, or whatever, but it's not really that way. And this has been one of those extreme examples where we have to really deal with change as it comes. There's things we definitely know, like this is an infection. It's caused by this new or novel virus that was in animals and jumped to humans. And then there's things we probably never expected, that a vaccine would be available as effective as it was, and then B, that the virus mutated and has caused other problems, you know, for both vaccinated and unvaccinated people. And I think this is one of those times where we might not know. So certainly the vaccine protects the individual that has received it from getting very sick, dying, being on a ventilator, or even worse, ECMO, which is, gosh, in my mind, even worse than the ventilator, but or obviously, like I said, dying. But what we know, while it may have been protective from the first alpha virus or whatever, protective against spreading it, now the variants have made it, unfortunately, able to at least get the virus and then unfortunately pass it on to other people. And so that's why masks are needed. Like Dr. Lewis said, we're here to protect each other as well. And I think time is going to tell whether the vaccines kind of can adapt more quickly, or if the virus is going to adapt differently. So for now, the vaccine doesn't get you out of masking in science anyway, and then in a lot of institutions.
I can add to that in my opinion, I think we'll get there sooner if everyone continues to take this seriously. Get vaccinated if you're able, wear masks when you need to, practice good hand hygiene, socially distance when it's relevant. The more that folks can just do good common sense public health measures and follow the science, the sooner we'll hopefully be back to a maskless nation.
I think it's also
it is the race.
Sorry about that. It's also important to acknowledge some people are disappointed that, you know, they hoped that this vaccine was their ticket to normalcy. I remember the day that I got my vaccine, you know, my eyes got a little, you know, tearful, you know, because we'd been through so much, and it felt like such a great time. And it was, and it still is. It's a great success in terms of reducing infections, reducing hospitalizations, and reducing death. It's just incredible. However, it's not the only tool we have, and we can't rely on just one tool. And so we have to use all the tools that we can to decrease the risk. And we do know that people who are vaccinated, they can still get infection. They still can spread the infection. It looks like the duration of spread might be less, but it's not zero. And so I think, just pointing back to Dr. Forster and Dr. Lewis's comments of going with the science, and also going with one's desire to care for other people around us, but also acknowledging that, yeah, it's disappointing, but this is a pandemic, and it is challenging.
I love the analogy of the tools. You wouldn't build a house with just one tool. You know, you need I'm not a builder, but you need a hammer, you need a drill probably. And it really is a race. I mean, in the end, we've said this for a while, it's a race between the variants and the vaccine, and they're gonna edge each other out. And I do have faith. I do think obviously the vaccines and immunity is gonna come out eventually, but you're right. It is, the more we get vaccinated, I think that's still important to say, is that is still a super important tool that, has that the race towards a more herd immunity type idea is still really important, even if it isn't everything we thought it could be initially.
Excellent feedback. Thank you. A couple of questions have come in while you were talking. I'm going to kind of double this up because they kind of align together. So the questions are, what are the most common symptoms that you were seeing in children, and when do you recommend a child is taken for a COVID test?
The children on the street now are mostly 18 and older. I don't know if anyone else can comment to that. I know some general things, but can anyone else give some input on that?
What I've seen in the literature is that both for the Delta variant and for children, the symptoms can be a little bit different than the classic things that we were talking about a year ago. Coughing, fever, loss of sense of taste and smell. In children, I think we're still seeing fevers and cough, but also seeing headaches, abdominal pain, and some other symptoms like that. In terms of when to get a child tested, I would say, number one, as a family and community physician, I encourage everyone to have a primary care physician and touch base with with your primary care provider. If you have questions, if your child is experiencing symptoms that you think may be related to COVID, please touch base with a medical provider, and they should be able to direct you as to whether or not to get tested. Right now, at least in my practice, we are not recommending routine testing for children that don't have any symptoms. So that's a common question. Hey, my kid can't get vaccinated. Should I be getting them weekly tested or something like that? And at the present time, I don't know if Dr. Holliday and Dr. Forster are doing anything different, but my colleagues and I are not recommending just routine screening testing for children if they're not symptomatic.
I think the routine screening testing might be done on more of a kind of institution to institution basis. So for example, school might decide that that's one of the ways that they're going to decrease the spread. So in addition to masking, distancing, doing some testing on folks who are not symptomatic. I think the other thing to think about too with this is there are a very small percentage, but still some children who can get very ill, and sometimes some of those symptoms can be delayed a little bit. So I think it's also important to, again, have a primary care physician, pediatrician, or family doctor who's taking care of your child. And if you think that your child is ill, I have a low index of suspicion to go ahead and get tested, because it's also important for the spread issue too. If a child's infected, we know that they can spread it to others in the household, regardless of their age, that they can certainly spread it. And then if the child has had COVID, even if they were fairly mild symptoms, if the child's not acting normally, having additional symptoms, new rashes, fever, things like that, just get in contact with the primary care physician again.
And I don't treat children. I'm an adult physician, but certainly I've seen the data that's been out through the Ohio Hospital Association and the Cincinnati data as well. And we are seeing kind of a higher proportion of kids, it seems, with the Delta variant. Now, granted, we were doing different mitigation measures back earlier than we're doing now, but we are seeing more kids in the hospital. Cincinnati Children's is at much higher capacity than they have been before. I don't look at their data every day, but for what they had shared. So, it is, whether that's just because they form a higher percent of the non-immune population at this point, and that's how it spreads, or whether it actually is something that's causing more serious illness in kids. time is going to tell on that one.
Excellent feedback. Let's see here. We got another question that came through. Has the government shared any plans for children under age 12 to receive a COVID-19 vaccine in the future? And if so, will it be 2 doses?
It will likely be 2 doses. So those studies are still ongoing. I think anything I say now would, is a little premature, but they're trying to figure out I think they figured out the right dose, and then figuring out if kids' immunity, if it is going to be 2 doses, or children have a very different immune system than adults, especially the younger age group where they're still building a lot of these things. And so whether it's 1 dose or whether it's 2 doses or whether it's 3 doses, that's what the studies are out there to figure out for us.
And I've seen reports that there's some hope that these trials, as they go along, that there'll be availability of vaccination, but it probably won't be until I've heard late 2021 or early 2022. I don't know if that's what other folks have heard as well.
Yeah, I was going to echo that, Dr. Holliday. I've heard late 2021. Nothing official, but unofficially, that's what the people in the know that I've talked to are reporting.
Okay.
Thank you, doctors. That was very helpful. The next question is, what is the difference between the newer Delta variant and what we saw last year?
I'll let the infectious disease expert talk first.
Go ahead, Dr. Forster.
Yeah, one of the biggest changes is the higher viral loads. So we kind of talk about, the literal viral load is how much virus basically is in a cc or milliliter of blood, but basically higher amounts of virus. And that usually equates to higher infectivity, meaning that they can spread it to more people and that it is spread more easily. And we are also seeing a shorter time from time of infection to time of symptoms. And so that's kind of a shorter amount of time that they are able to spread it to someone else too. So we were normally seeing that about an average of 6 days, and now we're seeing about an average of 4 days. So those are 2 of the big differences. We are certainly seeing sick patients and even potentially younger than we were seeing previously. But again, that also may have to do with the vaccination rate, that the older population had a higher degree of uptake of the vaccine because they have other diseases and they saw their friends getting sick. So those are 3 of the main differences.
I can add on to Dr. Forster's wonderful comments there that in terms of how much more contagious is Delta variant, the data suggests that it's anywhere from 2 to 3 times more contagious than what we were seeing with the previous strains of coronavirus.
Thank you. Great feedback. The next question that just came in, this is a UC specific one. At UC, will instructors be required to wear masks when teaching, even if they are more than 6 feet from the nearest student?
The first thing I'll say is that at UC, we have a physician-led COVID response team that monitors the data and the latest science and the political information and the court of public opinion on a daily, if not hourly basis. And because of that, it's a very fluid decision-making body and recommending body. So what is in place today in terms of recommendations for faculty members is subject to change at any time based on the latest and greatest information out there. But at this present time, we have a universal mask indoor policy. So faculty members, staff, and students, when indoors, are supposed to be masked, with an exception that faculty members or staff people that are in a private office with the door closed can take their mask off, and another exception if you're eating or drinking. So we are less concerned about the space and more concerned with making sure that everyone just has their mask on when indoors, particularly in the classroom.
I will say that I've given 2 lectures in person with a mask, and it's not as enjoyable as without, but it sure does beat doing a Zoom lecture, in my humble opinion.
And I can tell Dr. Holliday that you're at UC because the lights are going off when you're not moving enough.
It gives me feedback that I don't move enough. It helps
go.
my physical activity.
I
I wanted
I'll,
to mention, I was going to
go
mention
ahead.
real quick, one of my pediatric colleagues that works at Children's had um, shared a couple bits of information in terms of the types of symptoms that they're seeing, cough, congestion, fever, headache, sore throat, and testing for any of those symptoms, and only testing if asymptomatic if they're exposed, and that they're definitely seeing many more cases and many more severe cases. And I heard from another colleague as well there that they're also seeing some co-infection with other viruses at the same time, including RSV, which causes something called bronchiolitis, which normally we wouldn't see this time of year. And so that might be influencing things as well.
And I'll just add one more thing about the teachers, even with space. And one of the reasons why I'm is what you see the leaders do. So teachers or leaders make it more normal to do something so that, certainly masks are required at UC, but at other schools that are making masks optional, that if the teachers and leaders do it, it makes it more normal and more okay for the kids that do want to mask, to feel okay with that. And again, I think we all three of us agree with the kind of, we're doing it for other people as well. Even though many of the teachers may be vaccinated, I think it's showing that you're doing that for each other is also an exercise in leadership.
I think that's a great point. Changing behavior is really hard. Just try if you want to see. And so we need all the help that we can get. And I think that kind of peer and also leader modeling can be just one of many things that can promote that.
Lauren, I think you're on mute.
Yes, it was frozen for some reason. Sorry, next question that came in. That was very good feedback, very helpful and really, really honest, which is what we're looking for today. So someone is asking if if the variants that are coming through, is that primarily caused by not enough people being vaccinated?
So this is a double-edged sword, since we're being honest. So certainly, when the virus is allowed to jump from person to another non-immune person, that's when the virus mutates and makes these variants. But I do it is a challenge to not think that way sometimes. But the enemy is the virus. And that really, it's all, you don't want to shut down communication ever, by kind of placing blame on anyone other than the virus, and so because we really are, it is a team sport, 100% a team sport. This is not what every single person does influences what, the effect for everyone else. So I try to avoid that, but I mean, by science, certainly when it jumps from non-immune, person to an infected person to a non-immune person, or even, it just allows to spread. That's when the mistakes of the virus happen, which is a mutation, which is which sometimes leads to variants.
I've heard it explained this way that viruses mutate at kind of a constant rate. That's what they do. And the more opportunities that they have to do that, the more they will do that. And so again, it's everything that we can do to decrease the number of infections and spread that's going to help the situation.
Very strong, politically inclined answers. You guys are great. I need you in some meetings that I have with Faculty Senate for your diplomacy.
And in this discussion about vaccines, I don't know if we want to open up this can of worms, but I think it's, I've heard it said before that every human being, you know, kind of starts with beliefs and then kind of figures out the reasons to kind of see how they make sense. And, you know, the conversations I've had with people, the ones that have gone well are the ones that I started with just admitting my own biases and saying that, you know, I'm just biased to believe that vaccines are great and that's where I'm coming from. And, and, and then I can hear them, you know, what are their concerns. And I think it's important to validate people's concerns, because if someone's concern is not validated, the conversation's kind of over, really. And especially if it goes into kind of talking down and blaming. That's where I'd like to echo Dr. Lewis's comment of just the importance of having a personal physician, you know, primary care physician that you can discuss this with, or specialist if they're taking care of some of your vaccination needs, because that's a relationship where there can be some trust, and you can really have a conversation about the risks and the benefits. I think the benefits far outweigh the risks at this point, given all the data that's coming in, but you know, we need to have a conversation.
Speaking to Dr. Holliday's point of all the data that's coming in, I read in the medical literature yesterday that coronavirus 19 is now one of the COVID-19 is now one of the most studied viruses and one of the most studied vaccines in history. So there is a tremendous amount of data that Dr. Forster and her team go through, and that's the data that we use to make the best recommendations that we can.
Thank you for that addition, Dr. Lewis. That's a really great point that you shared. Another question just came in. Are there any specific recommendations for regular mask wearing etiquette? Any benefit from wearing a cloth mask as opposed to disposable or the N95s?
So the N95, I'll start with the N95s because that's an easier answer. So it all starts, it's all about how the virus spreads. So the virus comes out of our mouth and nose. This is a respiratory virus as opposed to a bloodborne virus or something like that. So it comes out of our mouth and nose and into the air. For the most part, even though you can't see it, they're attached to little droplets of water, and they have a size. And then occasionally for some, we'll use TB as an example for some bacteria, or we could use varicella as well, which is another virus that is airborne, meaning those virus particles attached to the even smallest droplets of water, even though they're not droplets, and we call that airborne. So that's how tuberculosis is spread, and that's how, like I said, varicella can be spread as well. For the most part, COVID is just in the droplets, so the bigger particles. In certain occasions, like really loud singing, or if someone is getting a procedure in the hospital, for example, where we're in the nose or in the mouth, those can get in the really, really small particles. So that's what the N95s or K95s are kind of used for, are for those really, really, really small particles. The problem with just buying them in the store is they don't really work effectively unless you're fit tested. So all of us in the hospital have to go through a special process to make sure that it fits incredibly tightly around our nose and all the way around our chin. In fact, Dr. Holliday probably couldn't even wear one with a beard because, or both of you guys couldn't wear one right now because that interferes with how it attaches to our faces. And so in the general public, you're not going to get that fit testing, and that probably that mask is just as good as any other mask. It's not providing the extra protection that you think you're getting. In terms of cloth masks, there's plenty of data out there that, at least 2 layers, is what is recommended, and certainly with different, sometimes even different fabrics may be different. So silk, which is extremely well, or, tightly bound, lets less things through. Certainly, if you have access to the surgical masks and simple masks that they actually have their own grades associated with them as well, which I learned during this past year. I didn't know that really ahead of time. Those do provide a good level of protection, but what's really important is how it fits on your face. That is what's super important. Getting a surgical mask for a kid that doesn't fit well doesn't provide anything. If there's a lot of space here between the cheeks or above the eyes, or even kind of down here below the chin, it's not going to provide any protection. So it's really about how it fits on the face.
I'll add to that a key piece for cloth masks is making sure that you know the guidelines and the recommendations about when to wash it or reuse it. The CDC website has great information about duration of wearing masks. With the surgical masks like this, what are you supposed to do? Are you supposed to, reuse it or use a new one every time? With the cloth masks, you're supposed to ideally wash them every day or more frequently if they're getting dirty in between. So make sure that you're aware of those sorts of recommendations on the mask choice that you go with.
I've also heard it said, choose a mask that your child will wear. So if you can find one that would be, not only tolerable but maybe fun in some way, that would be a good plan as well. Because if it's not wearable for the person, then you're going to end up having a different kind of beard, a mask beard, because they won't want to wear it.
Absolutely love that, 100%. The best one is the one that's on over the nose and mouth. And since we're talking about masks, I'll just talk about how to take it off, because what we don't talk about is that when you touch that outside of the mask, which is trying to protect you or even, from the stuff that might be coming your way, if you touch that outside and then rub your eye or chew on your nails or something or another, then kind of defeats the purpose, and you're getting it back towards the mucous membrane, which can get you infected. So it's a lot of hand washing if you do kind of take it off that way, but generally speaking, it should be kind of around the ear loops where, it's not kind of in the path. And then, always wash your hands before touching your mouth or nose.
Excellent points. And it definitely resonated what Dr. Holliday mentioned about for children, making sure they have a mask that they like and they're comfortable with. My now 7-year-old son, I think we went through about 6 different versions till we got to the right ones that he loved, and then I ordered them in bulk. Really good points. Another question that just came through is some people are wondering, they're hearing that some vaccinated people could still get sick, and then some people are wondering why they should get vaccinated if they can still get the virus. Can you talk to us about that?
About the expectations before. A friend of mine who's wiser than I am once said that expectations are the blueprints for disappointment, and I think for a lot of people, myself included, we wanted this vaccine to just kind of end everything, and but if you look at how vaccines work, that's typically not how they work. They don't work by completely eliminating every infection. They help by reducing disease and disease and suffering and hospitalization and death. And this vaccine does a really good job at that. The fact that it doesn't completely eliminate infection, that is disappointing, and we need to acknowledge that. But I just hope people don't lose sight of the great benefit. One way to look at that is to look at the chance of people being really ill, having complications, hospitalizations, and death for any given kind of age group, whether they were vaccinated or not vaccinated. And it's really, really astounding, the difference. So I'm 51, and so I know that my risk of having serious complications is maybe 30 to 40 times higher than kind of a reference group like a younger person, but that is dramatically reduced since I've been vaccinated. So I don't know if that helps.
It does, thank you. The next question is, Someone is saying, I'm trying to understand how effective a mask is if you happen to be the only one wearing it, or one of only a few people in a meeting room or a classroom full, or a combination thereof with folks who are not. Physicians, can you speak to this a bit?
I think it definitely is protecting the mask wearer. So that's important. And if the mask wearer happens to be carrying the virus and not know it, or maybe even know it, it also is going to protect the people around them. In an ideal scenario, everyone in the room would be masked up, and everyone would be looking out not just for themselves but for each other as well. But you know, I think it's a good thing that we do have the power to control our own health to a very, very large degree as it relates to COVID-19. And again, to Dr. Holliday's analogy, there are many tools in our toolbox, but some of the most important tools for self-protection and protecting the people around you: get vaccinated, wear masks, wash your hands, and stay away from people when you can. Try not to go around people when you're sick or they're sick, and all those other things. Hugely, hugely important.
I use the Swiss cheese analogy a lot. So none of the things that we have, none of the tools are 100% effective. And each of them have their holes that the virus, you know, theoretically the virus could get through. So even wearing a mask, this, like Dr. Lewis said, ideally everyone would be wearing a mask at least 6 feet apart, not be there if they're sick, you know, and vaccinated. That'd be great. But certainly the particles come, so the mask is basically a physical barrier, stuff coming out of your mouth and the stuff you're breathing in. So both does, like Dr. Lewis said, protects other people around you if you happen to be sick and don't know it. There's some of those particles do get out, and this is where, you know, we get into why many of us have pushed for a more universal mask uptake in a lot of times, is because it does affect everyone around, and that, you know, if we could just minimize, you know, as much as we could by simple acts, minimize the virus spreading, you know, that would be great. But it does protect the mask wearer to a good extent, not 100% if someone's near you who happens to have it, but certainly decreases the chance of you getting it significantly.
That is a very good point, Dr. Forster. Thank you. Another question just came through. What does the recent FDA approval mean for the future?
I think one thing that it means is that hopefully a lot of people who were afraid to get vaccinated because it didn't have full FDA approval up until this point, it's been under emergency use authorization. But now at least one of the vaccines, the Pfizer vaccine, has full FDA approval. And I hope that that leads to more people who might have been on the fence getting vaccinated.
Excellent feedback, Dr. Lewis. Thank you. All right, we'll move into the next question. Somebody's asking, can you talk about what people are calling the third or booster shot? More specifically, is it realistic to think that the COVID vaccine will become an annual vaccine, such as the flu shot, or is it too early to make that speculation?
So a little bit of, there's a little bit of difference between the third shot and a booster shot. So the third shot that's currently recommended for immunocompromised people is kind of what we recommend for their initial series, right? So it's just trying to even get them to the immunity that the, you know, or protection that many of the rest of us non-immunocompromised people have. The booster, and so this is science at work. We've watched, if you think about the studies, the Moderna and Pfizer studies, they started about July of last year. You know, so the rest of us got to watch what happened to them, I guess, you know, and what we've seen is that some of their immunity started to wane about this time, about 8 months or so down the line. So likely that will be in place in September for most people. and potentially be a yearly thing. I think that's one of those things where I guess we'll see what happens with a lot of those people in the studies. Additionally, this is one of those, I'll take this time to talk about the mRNA vaccine itself and how kind of, I guess, cool it is, or really elegant is another way of saying it. But that message, that mRNA piece, is what tells what goes through our bodies to make, or at least in the outside of our cell, never touches our DNA, but just has a message for what the spike protein looks like. If this virus continues to mutate and that spike protein on the virus changes a little bit, the neat thing is that scientists can just tweak that part of the vaccine and keep, and that then give it to people, and then we can have a kind of a vaccine that can work against, if any undue vaccine really has a big change in that spike protein. And that's kind of what happens with the flu shot a little bit. We do a little bit more guessing with the flu shot each year, that we guess what the virus is going to look like that causes illness that year. Sometimes we're right, sometimes we're wrong. But it's similar to that if variants are allowed to kind of move forward.
Thank you, Dr. Forster. That was helpful to know, especially the specifics about the mRNA aspects. That's helpful. Let's see here. Another question just came through. For those wondering, there's some people wondering if there's a way to test if someone has the Delta variant specifically.
We've had that question asked by patients here. It's not routinely done as part of an individual's healthcare, but it is something that is watched by public health and infectious disease experts to see what's going on in the community. And it's from those sample collections that we can tell that the rate of the Delta infection has gone up quite a bit to be the predominant type. And we'll see future reports as well where they'll continue to watch for new variants as they come up.
Thank you, Dr. Holliday. That was helpful too. Another question that just came through, and we have time for about 2 more. So this one that just came through said, how long does the COVID-19 virus thrive on surfaces?
I don't know if we know the exact time. I will say we do know that it's not the primary mode of transmission, probably a lesser mode of transmission, on surfaces. It probably is a fairly short, most viruses in general actually only last a short time outside the body because it needs our host cells to do anything. It's not true of every single one, but for the most part, and certainly with other coronaviruses. So that's why hand washing is just real important, because it doesn't do a darn thing on my shirt or on a table unless I touch it and then it touches my mouth or nose. So it's just one more reason why, I've told people that, with different areas, you can clean, that's great. Certainly cleaning is important, but the really big thing is make sure there's hand washing stations or alcohol hand sanitizer available, because it's fine if it's on the surface, it just can't get to my mouth or nose.
Excellent points. Thank you, Dr. Forster. Another question that came through is, what are the parameters or rules around kids versus adults if either of them are testing positive for COVID-19?
And I wonder if they're referring to maybe isolation or quarantining potentially.
Sounds like it. It sounds like if they're exposed, what should they be doing? And is it different for children versus adults, is what I'm understanding.
I do not think it's different. I think that there are some nuances, particularly if there's an exposure and someone's vaccinated. So if someone was vaccinated and they were exposed to someone, then they, at this point, do not need to quarantine. But again, that could change. But I think the recommendations are essentially the same. If a great place to start is to talk to your physician, though, if you feel like you might have been exposed, or if you're having symptoms, that's where I'd start.
I'll plug the CDC website again. It's a great resource for people who have questions that we don't get to today.
Thank you, Dr. Lewis. Oh, go ahead, Dr. Holiday.
Yeah, that's a great point. In fact, there's a section in the CDC where it talks about isolating and quarantining and quarantine, and it goes through a very detailed description, including some of the nuances about the vaccine, and also potential for shorter periods of quarantine with testing on day number 5 after being exposed.
Excellent. Thank you, Dr. Holiday and Dr. Lewis, for that. And in fact, one of the last questions that we had is if people are looking for more information about COVID-19 vaccinations or side effects or any of those types of things, what are the best websites for folks to visit?
I'll plug the CDC again. One thing that impressed me about the CDC site is that you will certainly see a pro-vaccination message, but you'll also see them address questions about risks, and they're very specific about the risks, about specific types of vaccines. I would be uncomfortable with a source that only showed one side. And I think it's important to see, several sides of an issue. Another site that I would recommend, and this goes back more to just taking care of kids, is the AAP's materials on COVID. Healthychildren.org is an excellent website. It's a kind of a patient and family education website, and they have very specific articles on COVID. Including all the specific questions people may have if their child has special needs or other health problems. So very good resource there.
I'll add to that for any students, faculty, or staff, or parents of students, faculty, and staff at the University of Cincinnati, we have a public health website that details all of our plans, what we're doing, all of the requirements, recommendations, and guidelines across campus.
And for kids, I really liked Cincinnati Children's website as well. Not only did they do some of the studies, so, a lot of the, research is coming right out of our own backyard, but they've actually done vaccine research for a really long time before, forget COVID, before that. Cincinnati Children's is known, internationally for that, but they have a really cool, it's like a Mythbusters site. So I think it was kind of especially about, the things that we worry more about our kids maybe than we worry about ourselves sometimes, right? So like the infertility mess, the stuff that was out there, right? That I looked at it just so I could tell people kind of where did that information even come from? And then B, how can I prove, or at least, give data to the opposite about, the myth, and kind of just trying to bust the myth. But so I thought it was a really good website too. And then I still will reiterate, everybody has a little bit different side effects, and it may have to do with kind of your other medical problems. So once again, you've heard all of 3 of us say it. You should, talk with your primary care physician or other physician just about, again, which of the vaccines might be good for you. For certain people, the mRNA may be preferred over the Johnson & Johnson or other vaccines for certain reasons.
Thank you, Dr. Forster. Great points there and additions. In fact, we had so many great questions from our participants today, over 100 participants on today's session, and a huge and special thank you to Dr. Lewis, Dr. Forster, Dr. Holiday for your leadership and engagement and expertise today. It was an honor serving as your moderator, and now I will turn things back over to Cynthia for some closing updates.
Great. So thank you, Lauren, and thanks to our physician panelists for sharing your expertise with us today. So this event is part of Bearcats Health, a virtual program series brought to you by the UC Alumni Association in partnership with UC Health, our academic health centers, and other campus and community partners. Keep an eye out for the post-event email in the coming days with a recording of this program. It'll also include a link to the Bearcats Health website where you can learn more about our virtual health programs. Our next program will take place on September 23rd, where we will be joined by a panel of physicians from the UC Health Center for Reproductive Health. They will be discussing your family journey, advancements in reproductive health. Again, thank you to Drs. Lewis, Forster, and Holliday for presenting today, and thank you to all of our participants for tuning in. This concludes today's program.